I'm Mary Lee. I'm the physician-in-chief for Nemours, Delaware Valley. I was delighted that Matt reached out to us about a month ago to talk about whether we could collaborate together to provide testing and screening for first responders in the county. And at that time, we didn't have all the resources we needed, but he has been really helpful in helping us to ramp up the resources. We've increased our staffing and created a program to be able to provide this testing. And I think that it will be really important that we can provide some surveillance over a few weeks period. And this will be a really nice index case of what we may need to do to expand testing to essential employees in Newcastle County and across the state as we start to bring more businesses back, but particularly those first responders and healthcare systems. Thank you.
Thank you so much, Dr. Lee and Acting Chief Logeman, Deputy Chief Alston, one of the testing subjects today, and all of you who came here today. My name is Matt Meyer. For 6 weeks now, it's been our policy at the county that there are 3 ways we're going to get out of this. 1 is there's going to be a vaccine. 2 is there's going to be effective treatment. Or 3, there's going to be an effective testing regime, contact tracing, and the like. The first 2 are largely outside of our control in county government. And so we focused on the third element, which is trying to increase testing. We've worked with the governor, with the Division of Public Health, and for the past 4 weeks, several times a day with Dr. Lee and the fantastic leadership at one of our true community treasures, and that's Nemours AI DuPont Hospital here. It's vitally important we make testing more available, not just to symptomatic individuals, but to asymptomatic individuals. A study performed in recent weeks in San Francisco in the Mission District showed that 90% of those tested positive, asymptomatic people, were essential workers, people going out every day to serve us. So we're honored to start in county government with our paramedics. You're going to be hearing later today or tomorrow about 200,000 saliva tests that are going to be made available, mass testing for the people across our county and state. And we're excited about that collaboration as well. We're working harder than ever for you. We understand that there are a lot of people out of work right now. There are a lot of people who want to go back to work, business owners who are eager to get back to what they were doing before. It's our job to make sure when we're ready to do that, everybody can do it safely, both employees and patrons, customers of businesses, even patients right here at Nemours Hospital. So we're very excited for this partnership. Dr. Lee and I just were meeting for half an hour trying to figure out how to expand it to other groups and grow it. So thank you very much. And thank you most especially to the fantastic swab mob here behind me who are out here every day to keep us all safe. Thank you.
I was just going to say, Matt, where'd you get the money for the tests?
So we, for the past 3 years, have been working on building up our reserve. We built up a reserve of close to $40 million. And I committed, when I announced my budget 6 weeks ago, to first and foremost put that money to work to address the crisis in any way we can. Now, thanks to the great work of Senator Coons, Senator Carper, and Representative Blunt-Rochester, there's some federal money that is coming, and we'll likely use the federal money to reimburse your county treasury for testing like this and for other things we're doing to keep both county employees, first responders, and everyone across our community safe.
Is it becoming easier and easier to get tests? Was it hard to get tests in the beginning?
It is getting easier. It's interesting that the expertise, if you talk to Dr. Lee and a lot of these swab mobs here, the expertise was there. A lot of the machinery was there. The supply chain was, I think it's fair to say, the biggest issue, finding chemical reagent, primers, things of that sort. And also technologies like the saliva, the oral swab technology was not there. I think four weeks ago it wasn't approved. It was still in research. So yes, the technology is improving, and we anticipate it will continue to improve.
So the goal is going to be to just get everybody in Newcastle County tested?
The goal is to have a system to have a testing regime in collaboration with the governor, who obviously is on the front lines doing amazing, courageous work to keep us all safe, and our Division of Public Health, and to work within that system and structure to make sure that as many people as possible can get tested. We're fighting an invisible enemy right now with efforts like this. The swab mob, Dr. Lee, Dr. Greenspan, the leadership of Nemours, we're making it just a little bit more visible, both for our heroes, our first responders, and for the community at large. All right, thank you.